My name is Jegan Krishnan. I'm a professor of orthopedic surgery, and I've been doing joint replacement surgery for nearly 30 years. And it's my privilege to help you through your joint replacement surgery and speedy recovery. I'm going to describe to you your journey through a hip replacement procedure. Here's an example of a hip replacement. So a hip replacement, the hip is a ball and a cup joint. So we screw in a metal shell into the pelvis, and the shell has a plastic liner like this, and the plastic liner is very low friction and therefore allows the implant to last for a long period. And the ball is attached to the end of a stem. This is an example of a real implant that will be in your body. It's coated specially with a surface that attracts the bone to hold on to the implant quite firmly. And this is then placed into your thigh bone, and then the ball and cup arrangement is complete. So the actual operation will take 1 to 1.5 hours to complete. So you'll come into theatre and the anesthetist will anesthetize you, will appropriately position you, and then commence the surgery. Once the incision is made and the muscle is removed out of the way, we will then expose the joint to carry out the joint replacement procedure. You will be given antibiotics during and after the surgery to reduce the risk of any infection, and you will also be given some blood thinning medication to reduce the risk of getting any clots in your leg. You will have a drain coming out of the wound, and this is to remove any excess blood, and this reduces swelling, decreases pain, and allows you to mobilize quicker during your recovery phase. After this, you will also have a bladder catheter, and the aim of this is really just for your comfort, so that you don't have any anxiety about rushing to the toilet after the surgery, and that you're kept comfortable. You will feel that the leg is a little numb after the surgery, and that's because we fill the joint up with a lot of local anesthetic, and the anesthetist would block some of the nerves that supply the joint to reduce the amount of pain that you have post-operatively. After the surgery is done, you'll be transferred to your bed, and you will be then taken to the recovery area. You will be in the recovery area for about 1.5 hours. During that period, observations will be taken to make sure you're stable, and an x-ray will be done of your hip. And the main reason for the x-ray is to make sure that there are no complications of the surgery and the joint is sitting in the right position. Following the surgery and the recovery, you'll then be transferred up to the ward. Once you're comfortable there, around about 4 hours after the surgery, the nursing staff will come and check you, and our physiotherapist will get you up and standing and walking around the bed with either a frame or some walking assistance. And then you'll be sitting out of bed. The drains stay in overnight, so the next morning they will remove the drain and also your catheter, and you'll be having more exercises in bed and then walking along the corridors of the ward with your walking frame or walking stick. You'll be in hospital for 3 to 4 days, and then based on your requirements, we will provide some transport assistance home if you require, and then you will have a daily visit from our nurse at home to make sure you're recovering well and to attend to any of your needs. And this we provide for you for 7 days. After that, our physiotherapist will then kick in with more exercise programs to help your muscle strength recover and also your range of motion. We will be giving you significant medication for pain relief, which will start during the immediate post-operative period, and they will be oral tablets. And it's important that you take these regularly, because if you don't and you wait for the pain to kick in before you take these medications, there will always be a lag. So it's important that for the first 2 or 3 weeks you take these medications regularly, and that'll keep you on top of your pain and make you recover in a more controlled fashion. So you will need walking aids for anything between 6 to 8 weeks after the surgery. After that period, generally you won't need walking aids, and the walking aids are either a walking stick or a walking frame, depending on your stability, comfort and confidence. You will be seen at 2 weeks by our nurse to check your wounds. There will be a special dressing put on, which she will attend to. There are no sutures to be removed because we use dissolving sutures. You will be seen by me at approximately 6 to 8 weeks following the surgery, and again at approximately 3 months following that appointment. Once you have done that 6 to 8 week period, generally most patients are off any walking aids. It takes somewhere between 3 to 6 months for you to be comfortable with your new joint replacement and confident as well. And this varies from patient to patient based on their age and other comorbidities, or whether they have any other arthritic joints. But generally, around about 6 months, you're walking without any aids, and between 6 to 12 months before you feel that it feels like a normal hip and you don't feel like you've had the surgery.